Good morning, good evening, good afternoon. I hope all are fine. It's been a while since I've been around, and I have an interesting topic to discuss with you all. And thank you for those who have supported me. Thanks for those who have subscribed. Continue to subscribe. Tell a friend to tell a friend. Thank you. The topic today I want us to discuss is about the skeleton. We cannot talk about orthopedics, management of orthopedics, understanding orthopedics, or discussing orthopedics without knowing the skeleton. The skeleton, I would say, is the major backbone of orthopedics. And just a brief definition. A skeleton is the framework structure that it's the framework that provides structure to the rest of the body. It is made up of ligaments, it is made up of bones, it is made up of muscles, it is made up of tendons. In a nutshell, what we are trying to say, we have to know more about the skeleton for us to discuss it. Within the skeleton offers in itself, it offers attachment for muscles, it offers attachment for ligaments, it offers attachment for it has bones that also protects, it also offers movements. So in a nutshell, we would classify them according to their length, according to their shape, according to where they are located. For instance, we have long bones, we have flat bones, we have sesamoid bones, we have irregular bones, we also have short bones. The skeleton is divided into two. We have axial skeleton and appendicular skeleton. Axial skeleton are the skeletons of the skull. Mainly they offer protection of the internal organs, whereas the appendicular skeleton offers movement, attachment of muscles. So in an adult person, human being, in orthopedics we don't call an adult with 18 or 16 years. We check for the x-ray, we see if they are fused. If they are fused, they cross over to the adult section even if they're teenagers. But again, in an adult, they have 206. For me, I have 206 bones. For a child, their bones may be more because they are not yet fused. Some are still growing, so there is a lot of confusion, I would call it, but the structure of the baby remains the same. So the baby has more bones than a grown up. Let's start with the long bone. An example of a long bone is femur, is the most common. Long bone, I know most people know, but we have humerus, we have radius ulna, we have tibia fibula, yes, and many others. So the long bone is composed of bone marrow that produces blood components like white blood cells, red blood cells, and platelets. When an infant is born, they normally have red bone marrow, but as they increase in age, the red bone marrow become yellow bone marrow, so they are not in a position to produce the blood components. But this bone marrow, the femur, the long bone, has a cavity that has the bone marrow in itself. It contains blood vessels inside, it contains connective tissues inside. Yes, and then we have flat bones. Flat bones are thin, how would I call them? They are thin, flattened, and curved. They have bone marrow with no cavity. They offer protection to the internal organs. Yes. For the long bones, they offer majorly movements, attachment for muscles. Yes. Short bones are bones that are almost similar in length, width, and all that. For example, we have tarsals and metatarsals. These bones offers movement, they offer stability to move, and yeah, basically that is much of it. Irregular bones are bones with no shape. You can't really put them in any shape, but they are majorly of the vertebrae, and they offer protection and attachment of muscles. We have also flat bones. Flat bones also offer protection, and they are majorly found in the thoracic cage. Yeah, for that matter, let us move to the cranial. Cranial is the head. So just to mention a few, the head has they have 8 bones, namely occipital, parietal, temporal, occipital, parietal, temporal, frontal, and ethmoid. Within the skull, within the cranium, we have sutures. Sutures are lines that offer room for the skull to grow. And the sutures, when you are born with sutures. Some fuses after 2 months, some can take up to 2 years. So we have major cranial sutures. They are include lomboid suture, and it is between parietal and occipital bone. We also have coronal suture between frontal and parietal, and we have sagittal suture between 2 parietal. We also have sphenoid. Some, especially the sphenoid, mastoid, and posterior fontanelles, this closes after 2 months, while the anterior fontanelle may take up to 2 years. And then we go to the thoracic cage. The thoracic cage is made up of 24 vertebrae, and it is also with part 2 for us to discuss about the rest of the bones that we have not discussed as we proceed. If you have any question, kindly put it across. You can reach me through the inbox. You can write on the comment below. Thank you, and keep subscribing. Thank you.